Hey everyone, and welcome back for another deep dive.
Excited to be here.
Today we're tackling something that might feel a little bit taboo for some people,
Yeah.
but it's so important for so many people.
Mm-hmm.
Atrophic vaginitis.
That's right.
Whether you are maybe prepping for a doctor's appointment, or maybe you're just curious about your own body, or
Sure.
you're trying to have a conversation with a friend or loved one.
Right?
We're going to break down everything you need to know about atrophic vaginitis.
Absolutely. And we'll do it without all the medical jargon,
That's right.
so you can really understand what's going on.
Exactly.
Atrophic vaginitis, sometimes called vaginal atrophy,
Oak.
basically means that the vaginal walls are thinning and drying out,
Okay.
and it's incredibly common,
Wow.
especially after menopause.
Okay.
In fact, studies show that around half of all postmenopausal people experience it.
Wow, that's a really big number.
It is.
So before we go any further,
Yeah.
I think it's worth just defining menopause for anyone who's not totally familiar.
Is
Menopause is basically that stage of life.
Right.
When a woman's ovaries gradually stop releasing eggs and her periods eventually stop.
Mm-hmm.
It usually happens naturally between the ages of 45 and 55.
Yeah.
But it can also happen earlier
Right.
due to certain medical conditions or treatments.
That's right.
And one of the big changes that happens during menopause is a drop in estrogen production.
Yes.
It's like if you imagine your body's estrogen production is like a factory.
Okay.
Before menopause, it's running full steam ahead.
Yeah.
But after menopause, it's like it's down to just a small little workshop.
Exactly.
And that drop in estrogen plays a huge role in atrophic vaginitis.
Absolutely.
So estrogen is kind of like the key ingredient
Yeah.
that keeps things running smoothly down there.
You can think of it that way.
Okay.
Estrogen helps to keep those vaginal tissues healthy, lubricated, and elastic.
Gotcha.
When those estrogen levels decline, the tissues can become thinner, drier, more fragile.
Oh,
Kind of like a grape turning into a raisin.
okay.
Maybe not the most pleasant image,
Yeah, not the most pleasant image.
but it kind of gets the point across.
Yeah, I get it.
You know?
So I can definitely see why this is such a common issue.
Yeah.
But let's talk about the symptoms.
Sure.
What does atrophic vaginitis actually feel like?
Well, the symptoms can vary from person to person.
Okay.
Some people might just notice a little bit of dryness,
Mm-hmm.
while others have more bothersome symptoms,
Yeah.
like itching or burning
Okay.
or pain, especially during intercourse.
I see.
And sometimes, those symptoms can be so subtle that they're easily dismissed as just part of getting older.
Oh, I see. So it's like, oh, I guess things just change as you get older.
Exactly.
But it's important to know that these changes aren't something you just have to put up with.
Absolutely not.
Right.
There are things you can do.
Mm-hmm.
And I think there can also be a sense of embarrassment around these symptoms,
Sure.
which can prevent people from seeking help.
Yeah.
They might think, oh, it's just me. I don't want to bother my doctor with this.
Right.
But it's so important to remember that you're not alone.
Absolutely.
This is a really common issue.
Okay. So if someone is experiencing any of these symptoms,
Yeah.
what's the next step?
Well,
How is atrophic vaginitis actually diagnosed?
good question.
Knowing these potential causes, how does a doctor figure out what's going on?
Yeah, so diagnosis is usually pretty straightforward.
Okay.
It typically involves a pelvic exam
Mm-hmm.
and a conversation with your doctor about your symptoms.
Okay.
They'll be looking for any physical signs of thinning, dryness, or inflammation in the vaginal walls.
Gotcha.
They might also ask about your medical history,
Uh-huh.
including whether you've gone through menopause or had any treatments that could affect your estrogen levels.
Makes sense.
And sometimes they might do a test
Yeah.
to check the pH level of your vagina,
Okay.
which can give them more information about the health of the vaginal environment.
I see.
It's really about getting a good picture of what's going on.
So it sounds like that initial conversation with your doctor is really key.
It is.
Absolutely.
It's estimated that up to 70% of people with atrophic vaginitis don't seek treatment,
Wow.
often because of embarrassment or misconceptions
Yeah.
about the condition.
Yeah.
But it's so important to remember that this is a common medical issue, and there's no shame in seeking help.
I think there's still a lot of stigma around talking about vaginal health,
There is.
which is a shame because it's such an important part of overall well-being.
It is a part of overall well-being. And,
Yeah.
with the right treatment, so many people can experience a significant improvement in their quality of life.
Okay.
It's all about having the knowledge
Yeah.
and feeling empowered to advocate for your own health.
That's so important. So it's really empowering to know that you don't have to suffer in silence.
Absolutely not.
But before we dive into treatment options,
Yeah,
I want to touch on something that you mentioned earlier,
sure.
the connection between vaginal changes and urinary issues.
Hmm.
I have to admit, I was surprised to learn about that link.
Yeah, a lot of people are.
Right.
It is surprising.
But it makes sense when you think about it.
It does.
We talked about estrogen being crucial for vaginal health,
Right.
but it also plays a big role in keeping the urethra healthy.
Yes, it does.
And that's the tube that carries urine from your bladder.
Mm-hmm.
And just like the vaginal tissues, the urethra can also become thinner
Right.
and less elastic as estrogen levels decline.
Exactly.
So it's like a double whammy.
Yeah.
The changes in the vagina A&D, the urethra can team up
Mm-hmm.
to cause those pesky urinary symptoms.
That's a good way to put it.
Okay.
And sometimes those urinary symptoms like having to go more often or feeling a sudden urge to pee
Yeah,
or even experiencing burning during urination might be the first clue that something's up.
that's a really good point.
Yeah.
So even if you're not experiencing like any vaginal dryness or discomfort,
Right.
those urinary changes could be a sign to
Mhm.
check in with your doctor.
Absolutely.
Yeah,
It's always better to be safe than sorry,
I like that.
especially when it comes to your health.
Absolutely.
Yeah.
Okay, so we've got a good grasp on the symptoms,
Yeah.
the diagnosis process.
Mm-hmm.
Now let's talk about treatment.
Sure.
You mentioned that there are a lot of effective options available.
Yes, there are.
What are some of the first steps someone might take if they're experiencing mild symptoms?
Well, one of the simplest and most accessible options is over-the-counter vaginal moisturizers.
Okay.
They're kind of like skincare for your vagina.
Okay.
They help keep the tissues hydrated
Mm-hmm.
and can provide relief from dryness and irritation.
I see.
And you know what's great about them?
What?
You can use them even if you're not experiencing any symptoms yet,
Oh, wow.
just as a preventative measure.
Okay, I have a confession.
Okay.
Before I started researching this topic,
Yeah.
I totally thought lubricants were just for, spicing things up in the bedroom.
Oh, yeah.
I had no idea they played such an important role in overall vaginal health.
That's a common misconception.
Yeah.
But lubricants are essential for anyone experiencing vaginal dryness,
Right.
regardless of their age or relationship status.
Wow.
They can make intercourse more comfortable,
Okay.
reduce friction, and prevent irritation.
Okay, so moisturizers for everyday hydration
Exactly.
and lubricants for more intimate moments.
Yes.
Got it.
You got it.
But what about addressing that underlying issue of low estrogen?
Right.
I know there are prescription options available.
There are.
Can you walk us through some of those?
Yeah, so when those over-the-counter options aren't enough, or if someone is experiencing more severe symptoms,
Yeah.
estrogen therapy is often the next step.
Okay.
And there are two main types,
Okay.
local estrogen therapy
Uh-huh.
and systemic estrogen therapy.
Okay. Let's break those down.
Okay.
What's the difference between local and systemic estrogen therapy?
So local estrogen therapy delivers a low dose of estrogen directly to the vaginal tissues,
Okay.
right where it's needed.
Gotcha.
It comes in a few different forms, creams, rings,
Uh-huh.
and suppositories, or vaginal tablets.
Can you walk us through how those work?
Sure. So with vaginal estrogen cream, you apply it directly to the vaginal walls using an applicator,
Okay.
usually once a day or a few times a week.
Mm-hmm.
The estrogen molecules in the cream are small enough to be absorbed through the tissue
Okay.
and get to work restoring the vaginal lining and reducing dryness.
Interesting.
Estrogen rings are small, flexible devices that you insert into the vagina,
Us?
and they release estrogen continuously over several weeks or even months.
Wow.
And then there's suppositories, which are basically little tablets that you insert into the vagina,
Mm-hmm.
and they dissolve and release estrogen gradually.
So it's really about finding the delivery method that best fits your lifestyle and preferences.
It is.
Does one type tend to work better than the others?
They're all quite effective.
Okay.
The best option for you will really depend on your individual needs and your comfort level with different application methods.
That makes sense.
Yeah, your doctor can help you figure out what makes the most sense for your situation.
And what about systemic estrogen therapy?
Okay.
How does that work?
So systemic estrogen therapy involves taking estrogen in a form that gets absorbed into your bloodstream,
Okay.
like pills, patches, gels, or sprays.
Mm-hmm.
This type of therapy can be very effective for treating not only atrophic vaginitis, but also other menopausal symptoms like hot flashes and night sweats.
So it's more of a whole body approach.
Exactly.
Okay.
But it's important to note that systemic estrogen therapy does carry some risks.
Right.
So it's crucial to discuss the potential benefits and drawbacks with your doctor to see if it's the right choice for you.
Now, you mentioned earlier that menopause isn't the only cause of low estrogen. Can you talk a bit more about some of those other causes?
Of course. So there are a few other situations that can lead to a decline in estrogen production, which, as we know, can lead to those same symptoms of vaginal atrophy.
Right.
For example, some women experience primary ovarian insufficiency,
Mm-hmm.
which means their ovaries stop working properly before the age of 40.
I see.
There's also premature ovarian failure,
Mm-hmm.
which occurs before age 40.
Okay.
And then there are certain medical treatments,
Right.
like chemotherapy or radiation for cancer, that can damage the ovaries and impact estrogen production.
Right. So it's like a domino effect.
It is.
One change can trigger a cascade of other changes in the body.
That's a great way to put it.
Yeah.
And that's why it's so important to pay attention to what your body is telling you
Yeah.
and seek medical advice if you notice any unusual changes,
Right.
especially if you're experiencing any of the symptoms we've been discussing.
Now, before we wrap up our discussion on treatment,
Yeah.
I want to address something that I think a lot of people might be wondering.
Okay.
Can atrophic vaginitis be completely reversed,
Mm-hmm.
or is it something you have to manage long term?
That's a really common question.
Yeah.
And the answer is a bit nuanced. While you can't completely reverse the natural decline in estrogen that happens as we age,
Right.
treatment can significantly improve your symptoms and prevent the condition from worsening.
So it's more about managing the symptoms
Mhm.
and maintaining vaginal health rather than trying to turn back the clock.
Exactly.
Okay.
And with the right treatment, many people can experience a dramatic improvement in their quality of life.
Yeah.
They can enjoy intimacy again,
Mm-hmm.
feel more comfortable in their bodies, and avoid those frustrating urinary issues.
That's so reassuring to hear.
Yeah,
I think it's important to emphasize that point treatment can truly make a difference.
it can.
It's not something you have to just live with and suffer in silence.
Absolutely not.
There are so many effective options available.
Yes.
There are. And there's no reason why you can't reclaim your comfort and confidence.
Exactly.
And that's a powerful message.
It is.
Now, before we move on to our final thoughts,
Yeah.
I want to circle back to something we briefly mentioned earlier, SERMs, or selective estrogen receptor modulators.
Yes.
Can you tell us a bit more about how those work and how they differ from traditional estrogen therapy?
Absolutely. SERMs are a fascinating class of medications.
Okay.
They work by targeting specific estrogen receptors in the body.
Gotcha.
Think of it this way. Estrogen receptors are like little locks,
Okay.
and estrogen is the key that fits into those locks
Mm-hmm.
and triggers certain effects.
Okay.
SERMs are like a special type of key that fits into some locks, but not others.
Oh,
So they can activate estrogen receptors in the vagina to improve tissue health,
okay.
but they don't activate estrogen receptors in other parts of the body, like the breasts or uterus.
That's a great analogy.
Thanks.
So SERMs offer a more targeted approach to estrogen therapy.
They do.
Interesting.
And because they have a more selective effect, they may be a good option for women who can't take traditional estrogen therapy
Mhm.
or who are concerned about the potential side effects.
I see.
But as with any medication, it's important to talk to your doctor to see if a SERM is right for you.
This has been such an informative conversation.
It has.
And I'm sure our listeners are feeling much more knowledgeable and empowered about this topic.
I hope so.
Right.
Knowledge is power.
Yeah.
And when it comes to your health, feeling informed is the first step toward making the best decisions for your body and well-being.
We've covered a lot of ground today.
We have.
From the symptoms and causes of atrophic vaginitis to the different treatment options available.
Right.
Before we wrap up,
Yeah.
I want to take a moment to talk about the emotional and relationship aspects of this condition.
Okay.
Because let's face it,
Sure.
experiencing these changes can impact not only your physical health,
Mm.
but also your emotional well-being and your relationships.
Absolutely. That's such an important point, and it's often overlooked.
Yeah.
You know, dryness and discomfort during intercourse
Yeah.
can understandably lead to anxiety and self-consciousness,
I see.
which can then affect intimacy and connection with your partner.
Uh-huh.
It can become a vicious cycle.
It can.
Yeah, yeah.
Absolutely. So what advice would you give to someone who's struggling with these emotional and relationship challenges?
Okay.
How can they start to navigate those conversations and
Yeah.
rebuild intimacy?
Well, communication is key.
Mm-hmm.
Talking openly and honestly with your partner about what you're experiencing is so important.
Right.
It can be helpful to explain the physical changes that are happening
Yeah.
and how those changes are affecting you emotionally and sexually.
It can be tough to start those conversations, though.
It can.
Do you have any tips for how to approach them
Sure.
in a way that feels safe and comfortable?
I think finding a time and place where you both feel relaxed and can talk without distractions is a good first step.
Okay.
You might want to start by sharing some information about atrophic vaginitis,
Yeah.
like what you've learned from this deep dive.
Right.
So your partner has a better understanding of what's going on.
And I imagine having a sense of humor can help too.
Absolutely.
Yeah.
Sometimes a little bit of humor can help diffuse any awkwardness or tension.
Yeah.
It's important to remember that you're in this together, and finding ways to connect and support each other can make a big difference.
That's great advice.
Yeah.
And if someone is feeling overwhelmed or struggling to communicate with their partner,
Right.
seeking professional support from a therapist or counselor can be incredibly beneficial.
I couldn't agree more.
Right.
A therapist can provide a safe space to process your emotions
Yeah.
and develop coping strategies,
Mm-hmm.
and they can also help you and your partner navigate these challenges as a team.
It's so empowering to know that there's support available no matter what you're going through.
Absolutely. You're not alone, and there's no shame in seeking help.
Well said.
Thank you.
On that note, I think it's time for us to take a quick pause.
Okay.
When we come back, we'll wrap things up with some final thoughts on managing atrophic vaginitis
Sure.
and some key takeaways for our listeners.
Sounds good.
We're back for the final part of our deep dive
Yes, we are.
into atrophic vaginitis.
Mm-hmm.
This has been such an eye-opening conversation for me.
It has been.
I hope our listeners are feeling the same way.
I hope so, too.
So before we wrap things up,
Yeah.
let's do a quick recap of
Wrap.
some of the key takeaways.
Sure.
First and foremost, we learned that atrophic vaginitis is caused by
Right.
declining estrogen levels,
Yes.
which is often linked to menopause,
Mm-hmm.
but can also happen for other reasons,
Right.
like certain medical conditions or treatments.
Exactly.
And that decline in estrogen can lead to some pretty noticeable changes
Yeah.
in the vaginal tissues,
It can.
like thinning, drying, and increased fragility.
Uh-huh. And those changes can then lead to a whole host of symptoms,
Yeah.
from dryness and discomfort to pain during intercourse,
Right.
and even those urinary issues that we talked about.
We also learned that it's super important to talk to your doctor
Yes.
if you're experiencing any of these symptoms.
Absolutely.
Ignoring the problem won't make it go away.
Yep.
And in fact, can increase your risk of complications like
Right.
recurring infections.
Exactly. But the good news is that there are so many effective treatment options available,
Right.
from over-the-counter moisturizers and lubricants
Yeah.
to prescription estrogen therapy,
Right.
including those targeted SERMs we discussed.
Yeah.
There's really no reason to suffer in silence.
And even if you're not experiencing symptoms yet, it's a good idea to be proactive about your vaginal health.
I agree.
Regularly using a vaginal moisturizer can help keep the tissues healthy and hydrated,
Right.
and may even help prevent some of those uncomfortable changes down the road.
I wholeheartedly agree. It's like taking care of any other part of your body.
Yeah.
A little bit of preventative care can go a long way.
Okay, so we've covered the physical aspects of atrophic vaginitis,
Mm-hmm.
but I want to circle back to the emotional and relationship side of things, which we
Okay.
touched on before.
Yeah,
Experiencing these changes can be tough.
it can be.
And it's important to acknowledge that it can impact not only your physical health,
Uh-huh.
but also your emotional well-being and your relationships.
Absolutely.
Mm-hmm.
It's completely understandable to feel frustrated, self-conscious,
Yeah.
or even a little bit anxious when you're dealing with these changes.
Right.
And those feelings can understandably spill over into your intimate relationships.
Right. So what advice would you give to someone who's struggling to cope with those emotional and relationship challenges?
Mm-hmm.
How can they start to rebuild intimacy and feel more connected with their partner?
Well, communication is key.
Yeah.
Talking openly and honestly with your partner about what you're going through is so important.
Mm-hmm.
And, sometimes just putting a name to what you're experiencing
Yeah.
can be incredibly validating.
That's true.
It can help you both feel less alone
Yeah.
and more equipped to face these challenges together.
It can be hard to know where to start, though.
It can.
Do you have any tips for how to approach those conversations
Okay.
in a way that feels safe and comfortable?
Well, I think finding a time and place where you both feel relaxed
Uh-huh.
and can talk without distractions is a good first step.
Okay.
Maybe dim the lights, put on some music, pour a glass of wine,
Yeah.
whatever. Helps create a relaxed atmosphere.
Right.
And remember, it's okay to start small. You don't have to dive into the heavy stuff right away.
Right.
Just sharing a little bit about how you're feeling
Yeah.
can open the door to a deeper conversation.
And you mentioned earlier that humor can be helpful, too.
Absolutely.
I love that.
It can really lighten the mood.
Yeah.
Sometimes just acknowledging the awkwardness can make it less awkward,
That's true.
and sharing a laugh can help you both feel more connected
Yeah.
and less alone in this.
So open communication,
Yeah.
a little bit of humor,
Mm-hmm.
and a lot of patience.
Yes.
That sounds like a great recipe for navigating these challenges.
I think so too. And remember, if you're feeling overwhelmed or struggling to communicate with your partner, seeking professional support from a therapist or counselor can be incredibly helpful.
Right.
They can provide a safe and neutral space to process your emotions
Yeah.
and develop coping strategies.
Yeah.
And they can also help you and your partner strengthen your communication skills and rebuild intimacy.
And if you're feeling a bit lost or unsure where to find a therapist,
Yeah,
your doctor can be a great resource.
absolutely. Don't hesitate to reach out for support.
Mm-hmm.
It's a sign of strength, not weakness,
Right.
to ask for help when you need it.
So well said.
Thank you.
And on that empowering note, I think it's time for us to wrap up this deep dive.
Okay,
We've covered so much ground today.
we have.
But the biggest takeaway I hope our listeners are left with is a sense of hope. Atrophic vaginitis is a common condition, and it's treatable.
It is.
There's no need to suffer in silence or feel embarrassed or ashamed.
I couldn't agree more.
Yeah.
By understanding the causes, symptoms, and treatment options, you can take control of your health and well-being.
And remember, knowledge is power.
It is.
The more you know about your body,
Yeah.
the better equipped you are to advocate for your own health and find the support you need.
So keep learning, keep exploring, and keep those conversations going.
Thanks for joining us on this deep dive.
It was my pleasure.
We'll see you next time for another fascinating exploration of all things health and wellness.